Hi, I'm Don Deems, and thanks for joining today's program. I'm very grateful to be here. I'm very honored to be here. My thanks go to Baylor College of Dentistry and especially to Dr. Bill Waltham, who is putting together this series. Today's topic is something that is probably one of the most important topics that will affect your life, both personally and professionally. As simple as it might seem. It's called listening, and it's about learning how to augment your listening skills. All of us think that we listen, and so I just want you to remember that developing good listening skills is your key to effective relationships, okay? It is the key, right? If you cannot listen effectively, you're not going to be a very good dentist. And you're not going to be a very good friend to people. So today I'm going to talk about listening in this short presentation, and I hope it serves as an introduction and something that you will continue with as you grow personally and professionally. So a couple things. First thing I want to tell you is that in the dental office, and I'm going to move this back one, in the dental office, listening to our coworkers and to our patients is probably the most important skill we can develop. Notice I didn't say just our patients, but I said our coworkers too. There'll be another program that we talk about the workplace, but understand that listening to our coworkers is very, very important also. Another thing that I want you to hear me say is that when asked, most of us would say that we listen all the time and that we're probably very good listeners. Yeah, I hear them. So you may be, and that's great. What we want to do is expand that listening repertoire, okay? We're going to expand that repertoire. Another thing that is often confused is the difference between hearing and listening, and they are two distinctly different things. They are two distinctly different things. So when somebody says, I hear you, that's not the same thing, okay, as really listening to somebody. Listening involves the heart, the soul, okay? It involves listening with your whole body, your full attention. And we'll get into that a little bit. Okay, another thing I want to talk about are some things that good listeners know, and these are not secrets, but they are very important things to know. So one is that, I mentioned earlier, that there's this huge difference between hearing and listening. Hearing, of course, is an auditory function. We all can hear, right? Some of us hear better than others, but we can all hear. Listening is a completely different thing. It's actually a skill. And so I'm augmenting your skills. That's what I'd like to accomplish today. Another thing is that there is huge value in actively listening to whomever we're having a conversation with. Huge value. And I'll tell you just a very short and quick story. I had a new client come into my practice one time, and I sat down with her and I said to her, "How can I help you?" And she sat and talked literally 30 minutes nonstop. And I looked at her and I listened and I listened. I never said a word. At the end of that 30 minutes, she looked at me in disbelief and she said, "You're the best dentist I've ever been to." Now, obviously, I had never completed dental work on her. So I hope that brings home a point to you, is that listening cannot be underrated. Being a healthcare worker, being a dentist, one of the most valuable things that you can do, and even to your friends and your spouse and your children, is listening, okay? So don't forget that one. Another thing that is sad but true, but it gives you an opportunity here, is that you're not able to hear everything in the course of a conversation. It's been tabulated that there are about 200 things that go on during a course of a conversation. Most of us can hear 2 or 3 or 4 things maybe going on in the conversation if we're asked about that. However, what I'd like to see happen, or I'd like to see you develop, is your ability to hear more. Let's work it up to 6 or 7 or 10. So what are those things? We're going to talk a little bit about that. Another thing to know is, as I alluded to, is what are we listening for? What are we listening for? Because when we know what to listen for, it allows us to pick those times when to respond to these parts of the conversation. Okay? All right. Another thing that good listeners know is that when you can listen well, it offers you options for navigating a conversation. When I say navigating, what do I mean? I mean literally, where is the conversation going to go? And how's it going to go? So you'll know when to be quiet, and you'll know when to pick in and ask some questions that may help provide some clarity or help them see things and understand things that they maybe never thought of before. All right? Another element is that listening frees you from having to know all the answers. So I'm here to tell you that, guess what? You don't know all the answers, and you never will. I don't now, and I've been practicing nearly 30 years. So if you will approach your person you're listening to and not worry about knowing the answers, that's a very important key to listening, okay? Just listen. Many times the person that you're talking to will come up with their own answers. So let's move on. A couple points to remember, I just want to review, is that as you learn to listen more effectively and deeply to people, you will become a great source of value to them. They will seek you out because they know that you're going to listen. Listening is not the same thing as providing information, okay? Listening is just listening. And there are times that you can offer some insight, but listening is not giving you your opinion or anything like that, all right? So the listening is a different component. So to truly hear another person, as I've written on the screen, means devoting your full attention to their communication so that you can catch the richness of it. When you are listening at this highest level, it involves literally all your senses. So much of communication involves nonverbal communication, and that's listening also. So it's body posture, it's tone, it's pitch, it's a lot of things, okay? So listening, you've got to take all of this in, and it's not easy to do. And so I'm going to give you some pointers as we move along on how can you do that? How can you become this really effective listener? All right? Okay. Some other points. When you listen with your whole being, that means your heart and your soul. You can hear the purpose of someone's communication and gain a genuine appreciation of who they are and where they are coming from. Okay? Who they are and where they are coming from. If you've got things going on in your head and you're you may be thinking about what you've got to do later, or you may be fantasizing about a vacation that's coming up. You are not really hearing them, and you're going to miss who they are. People, I've got to tell you, people are so interesting, and I hope that you really get that, and that you you understand that your enjoyment in this practice of dentistry is going to come from your involvement with people. Yes, there's satisfaction in doing good dentistry for people, but the real satisfaction is being able to serve these people, and a huge part of that is relationship, and a key component of that is being able to be a good listener, okay? So, when you're listening, as I mentioned previously, and it's the number one hardest thing to do, is quiet the chatter in your own head. That means clear things off. Clear what's going on in your head. So things may be very busy, for example, in your office. Before you go into another client, or a patient if you want to call them that, stop for a second and close your eyes and just tell yourself, let my thoughts go, clear my head, so that you can hear what they're going to say. You want to listen to what they say too. All right? Another very important point is and this cannot be overemphasized by any stretch of the imagination, value and allow silence in the conversation. Silence is one of the key components of listening. Silence, allowing silence. Silence is that space that allows people to talk. It's providing that space. Most people want to fill up silence with noise. Okay? Noise. Just be able to sit there without speaking and let the person talk. Just because they stop doesn't mean you need to start. Let them talk. Let them talk. You don't have to respond to everything. Just let them talk. Be interested. Most people have not had that experience, by the way, in their life. In fact, they're struggling to get in what they want to say. You will be of such tremendous value to people if you can just allow that silence. Allow them a chance to talk. Another thing is, choose a listening style that best suits the person that you are listening to. One of the great things about this profession is that we have a lot of people that we'll have the opportunity to interact with, and they are all different, all different. And so as you develop your listening skills, there are listening styles, which we're not going to have a lot of time to talk about in today's short program. However, you're going to want to choose what's the best way to listen to those people. Okay? But there are listening styles, and that might be something that you want to look into a little bit further. So, remember that. Another thing is, listen for what the person can or cannot say. This is especially true in dentistry. Dentistry is complicated, okay? It's a very technical profession, and people are sometimes embarrassed that they can't properly tell you what they're experiencing or whatnot, and they feel stupid for not being able to do that. I mean, I know people who are, PhDs and this, that, and the other, and when it comes to dentistry and dental health, they are at a loss. Their vocabulary is very limited, and their ability to explain things to you is often very difficult too. So you want to listen for those things which they can't say, okay? And you can help them along those lines. Another really important point is to listen for what's motivating the patient. If you come in to listen to a client with your own agenda about what you want to do, you're not going to get very far, okay? Listening for what's motivating the client is another way of saying understanding what their values are. All right? If you were to say to a patient, tell me your values, they're going to look at you like you came from another planet. Okay? So I wouldn't suggest that as a question, although you may find somebody that you're able to kind of ask that question and hear what their values are. But listen for what's really motivating I mean, you got to, so to say, listen between the lines, or listen between the sentences or words, or however you want to say it. You want to listen for that, okay? Another very important point is that, and we all have this, is listen to your own reactions. I'm saying listen to your own reactions. Yes, we all have reactions to what somebody says. It's very important that you just don't go, but, and interrupt. Listen to your own reactions. Let it go as quick as you can, and keep listening to the client or the patient or whoever you're talking to. There'll be a time if you need to, but most of the time, a reaction, of course, is a knee-jerk reflex, right? It's different from a response. So if you can just listen to your own reactions and understand how that affects you, then you'll become a more effective listener. All right. Now, listening as a skill. We're going to break this down a little bit. So we're going to talk about the elements of listening as a skill. Effective listening. To listen to someone in a conversation means to be fully present in a way that demonstrates that you are focused on him or her and what he or she is saying or trying to say. Okay? So that's what this really means. When you're effectively listening to people over the phone, which there'll be a significant amount of that goes on, and it will also go on with, especially with your staff, your team. Your ability to teach your team, by the way, how to listen is very important. Like you, they didn't have listening in school. It was never taught to them. It was never taught to any of us. And listening over the phone is in some ways much more complicated because we lose out on all the nonverbal stuff. We especially have to listen for the nuances of what's being said in the conversation. So it does involve some of the same skills as listening in person, but these little nuances, such as how quickly they're talking, how slow they may be talking, what their emotions are, what they're feeling, if they sound in a hurry, not a hurry, all these sorts of things. They're very, very important in terms of your response to them, and that's something that you want to pick up, and that takes practice, all right? A lot of practice. Now, another thing about effective listening as a skill is that we can receive phone calls regarding appointments, concerns, questions, and lots of other things. In fact, many prospective patients or clients, as I prefer to call them, are discouraged when they call in office because the phone experience is awful. And they may hear that you're a wonderful dentist, but if that person answers the phone in a less than desirable way and has very poor listening skills, they may already choose to leave your practice, and they haven't even gotten in your practice, okay? So understand that that is so critical. Please don't put somebody out to answer the phone without spending some time talking about phone skills and listening, okay? Because that is the first moment of truth about your practice. And there are lots of moments of truth, by the way. A moment of truth is the point at which a patient is making a decision to become a patient in your practice, okay? In fact, before they see you, it's been suggested that there are about 47 moments of truth. 47. So that's not part of this discussion, but we're going to move along. Okay. Effective listening also, whether it's in person or on the phone, your behavior speaks louder than anything that you might say. Anything. How you're communicating verbally, non-verbally, to them, for example. That's so important. If you're looking off in the distance, or if you're doodling, heaven forbid, or if you're being interrupted constantly, by staff members and people like that. How you handle all that is super, super important. So when you are with a client, you give them your full attention and look them in the eye and listen to them. Smile. Be open. Have an open posture, okay? Some of these things you know, all right? So just want to remind you of those. So let me kind of go in detail, and this slide is pretty involved, but I do want to go over some of these. So the first part is about body language. I've mentioned body language, of course, that's the nonverbal. So eye contact, mentioned about eye contact. Facial expressions, matching the expression in their face is very important. If they're crying, I wouldn't suggest that you cry along with them, but a look of empathy and understanding is very important, okay? Your voice tone. If they're talking very fast and they're very interested in blah, 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 that doesn't mean you've got to talk so fast that they can't understand. But what that does mean is that if they have a certain way of talking, maybe they're more quickly paced. Some people have a type of personality like they get to the point and get on with things. And if you're laid back and slow and you don't catch that, there's going to be a disconnection in your way of communicating with them. The other thing is the volume of your voice. If they're very soft-spoken, be soft-spoken. If they're loud, you don't have to be loud, but you can be a little bit maybe more above what you normally would speak, okay? And it may be because they're hard of hearing, all right? So pay attention to your volume, all right? If you talk loudly to somebody, it may affect them emotionally in a very negative way. Space. Space is important. Everybody knows about personal space. I believe you know about that. And in dentistry, we're very close to the people that we work with. We're given that privilege. However, when we're getting to know them, that is not necessarily something that is automatically given to us. So how much space we have, use your intuition and your feelings about how they come. Just as a practical example, in my practice, I use a round table in a consultation room. It's nice low lighting, it's very quiet, and I put tables around, chairs around the tables. And I just allow them to pick that. And if they go to the other side of the room, then I know, okay, I respect that. I'm not going to go all the way around the room and sit right next to them, because that's going to be a strong disconnect, and they're not quite ready for that, all right? They will be when they see that you're really interested in them and that you're listening closely to them. They will get it, and watch for the cues to learn to be a little bit closer to them. All right, watch for those cues. Another thing is position. All right, if they're leaning forward, then you want to lean forward too. If they're laid back with their arms kind of folded, right, we know what that means. All right. However they're doing, match that. Now, here's a funny thing. Let's say that somebody is in your practice and they're sitting back like this, okay? And you can tell that they're kind of defiant. Maybe they've had some bad experiences with some of our colleagues, and they may not want to be there. It could be that their wife, if it's a man, for example, has made the appointment for them and forced them to be there. So at first, respect that, okay? One of the interesting things that can happen is as you change posture, you know that you're communicating with them if they start following you, okay? You know that you're doing a good job when that happens. So initially you kind of want to match them, and then you slowly want to move it to a more open and receptive position, okay? So facing them, I kind of call it knee to knee, eye to eye, for example, is very important. It shows that you are open, that you are there to listen. all right? That you are there to listen. So this isn't rocket science, but it's something to be cognizant, to be aware of, okay? Be aware of that sort of thing. Okay, let's move to spoken language, another part. So as I mentioned, there is a great deal spoken in a conversation by the attitude, the style, and the type of language. Remember that the language that we use in dentistry is very technical. And your challenge is to not use such technical language that they just don't understand. So as you're listening to them, try to assess what their level of understanding is so that you can communicate with them. Because if you're unable to communicate, that means you're unable to help educate them, and ultimately you're unable to help them. It's just that simple. So formality. Technically, let's move along this. Formality. If your language is too casual, people may feel that they're discounted or unimportant to you. Remember that if somebody comes in and they're, because again, I mentioned you're going to meet lots of different kinds of people. If they come in a coat and tie, for example, they may be very formal about things, and you can be formal. That's great. If they come in a t-shirt and jeans, well, maybe they're laid back. Don't judge them. All right, that's just the way that they are. So find a way to understand that when you're listening, the formality of your spoken language, which is the part that we're talking about in listening here. You say spoken language and listening. Yes, it goes together. That formality is super important. A big no-no, and I have made these mistakes, is to use slang or jargon or humor. Be please super, super careful. No jokes, please, no jokes. Jokes, you just don't know what this person has experienced throughout their lifetime. You have no idea, okay? Just no idea. So avoid that if at all possible. Just if you choose to use a joke, please not at anybody's expense, and make it relevant to what you're talking about, okay? Another point is something that kind of sounds a little strange, but it's content ratio. So, you know, the content ratio is the relationship between the listening and the speaking, for example. You want to make sure that you're listening at least 80% of the time and speaking only 20% of the time. If you find the opposite being true, change it, okay? Learn to listen more, all right? When I'm working with dentists in coaching, I have this little pebble, silver pebble, and somebody gave it to me, and it says "listen" engraved in it. And I hold that pebble and I remind myself, listen, okay? And so I'm a professional listener, right? So I have to remind myself to listen. So just remember, listen, listen. Go into that room and just say, I'm going to listen, okay? All right. Now, another part here, which has a lot of information on it, is especially about the over the phone, is removing distractions. One of the things that is a constant struggle for people who work in your business office is noise. For whatever reason, it seems to be a collecting place for staff members, you know, things like that. If you want to know what it's like, go sit in their chair for a day and try to listen to what's going on the phone. All right, it's crazy how they're able to try to focus on what's going on. So stay away from them. You know, just let them do their job, and have your fellow team members stay away from them when they're on the phone, because that's very important. As a patient, of course, if they hear all this racket and stuff going on in the background, it's really, you know, very distracting to them too. So you want to have as quiet a place as you can, all right, for whoever is answering your phone. Interruptions. If you're on the phone, avoid interruptions at all costs. People hate that. I mean, do you like when you're on the phone and somebody says, "Can I put you on hold for just a minute?" How does that make you feel? Not so great, okay? Not so great. So avoid those interruptions if at all possible. So close the door, put up your hand if somebody comes to you to say, "Not now," basically, and focus, okay, on that. And the next point is proper equipment. Proper equipment is very, very critical. Think about that person in the front office who's answering your phone. You know, if they're having to do this all day or they're trying to do this, it's a problem. I mean, there's all kinds of technology available these days to make it comfortable so that they can hear and listen. And so make sure that there's good equipment, all right? There's good equipment that they can have control over all kinds of parameters, everything from noise reduction to not having to hold a phone. Maybe they can touch something, answer a call, etc. Okay? The next part of this slide, voice adjustments. Let's talk a little bit about that. And voice adjustments, we mentioned about volume on the phone. That's so critical because you don't see them and you're not there. Test the volume of the phone by you calling your office on a different phone, not inside the office, but on maybe your cell phone, for example, and listen for the volume and give that feedback to the person in the front office. Because if they're loud, that's a big turnoff. If the person can't hear them, that's a big turnoff, okay? So remember that. Tone, match it, right? Match the tone. The rhythm of the pace is also very important. So those are super critical. If they are talking quickly, it's probably in a hurry. Acknowledge that. Say, "It sounds like you're really in a hurry, so let's get to what needs to be talked about today." The expressions, believe it or not, people can kind of tell what your expression is over the phone. Back in the 1970s, which may seem like the ancient ages to you, for some of you, there used to be stickers that were available that we put on phones and it said, "Smile." I would suggest that you mention that and you yourself do that. Smile before you pick up that phone. It's amazing how it affects the conversation, and a person can hear that smile. As funny as that sounds, they can hear that smile over the phone, all right? So the voice and emotions are super critical, okay? Your voice and your emotions. So, you know, I mentioned about being emotionally ready. That's very important too for a phone call. So, there's something called contextual listening, which may sound really complicated. So let me first define context in a simple way that I hope you won't forget. A context is the container, okay, in which we hold the text. So it's relevant to whatever is going on at that time. So we've all heard the expression, "Oh, well, that was taken out of context," okay? Well, we're talking about contextual listening, so let me explain what that is. Contextual listening is taking into context in the conversation everything that's relevant and influencing the interaction. Some of the things that might influence this are the day or time of the call or interaction, right? Many times towards the end of the day, people are tired and a little bit worn out and frazzled. If you're the person receiving the call, be available, be listening. You certainly wouldn't want to say, "Hi, how can I help you?" You know, like it's an inconvenience or something. It needs to be that same energetic, open response that they hear. Okay. Another thing can be, recent public events. There could be personal events too. Obviously, a public event that everybody knows about, for example, was 911, as we call it, right? When people across the country were greatly disturbed, and it affected, the phone calls and things like that. it disturbed people very much. There are events in people's lives which go on that you have no idea of. Stephen Covey talks about a story, he tells a story about this, and he says one day this man is on a subway train in New York, happens to be, and he has 4 kids with him, and he's sitting there with his head kind of bowed down, and he is just kind of non-responsive, and his kids are like bouncing off the walls everywhere, right? And there's this other person in the car, the subway car with them, and he's just getting really agitated. And he's like, so finally he decides to speak up, and he says, Sir, could you please control your kids? And the man slowly looked up and said, I'm sorry. We just came from the hospital. Their mother died. Don't forget that story, because you never know when somebody calls you what is going to be going on. And you will get those calls, because we're in a people profession and people die, all right? And you will have patients of all ages, and some of them pass on, and some of them will be calling your office to let you know that, okay? So you never know, all right? But being able to adapt to that rather quickly is super important. So remember that, that knowing some of this is very important, very important. The emotional readiness of the person that you are calling is also very important. Sometimes people suffer from health problems or tragedies or who knows what, and trust me, I've heard it all and probably will hear more things. So understand that you may have an agenda or your staff may have an agenda for making a phone call, but if you are sensing or your staff is sensing that something's wrong, maybe it would be best to talk to that person another time by being gentle about it, saying, Mrs. Jones, it sounds like now's not a really good time for me to visit with you. Why don't I give you a call another day? Would that be okay? And they'll let you know, okay? They'll let you know. So be aware of that emotional readiness. And the other part is your emotional readiness. I mean, we are people, we have lives, things happen to us, right? We can have health problems, we can have deaths in the family, we can have financial disasters, we can have all kinds of things happen to us. So our emotional readiness is really important. Unfortunately, you're going to have to do your very best to put a lot of that over here so that you're able to answer a call or make a call. If you are not able to do it, don't make the call. It can wait. There is nothing that has to be done at this moment in time, okay? So take into account your own emotional readiness. All right, contextual listening can also include the success of the relationship so far, right? There are going to be clients that are not going to be happy with you for whatever reason, okay? Right or wrong, that's the way that they may feel. So, for example, they may be somewhat combative and upset with you. So take that into account, okay? It doesn't mean be defensive. It just means that, boy, you really got to pay attention and listen and seek to understand, okay? One phrase that comes to my mind is always this, and it's a good thing to remember when you're listening, is seek to understand rather than be understood. Seek to understand rather than be understood. Most of the time, the opposite happens again. We dentists are too eager to show how smart we are and everything like that, and it just goes right over the head of our clients. So I want to encourage you to seek to understand them. There'll be time later for you to talk to them about certain things. In fact, when they feel understood, they will give you permission to talk, right? They will look at you and say, okay, it's your turn. Literally. They won't say it out loud, but it will be there. Another thing to remember about contextual listening is, remember what you're talking about. But also, if it's a sensitive subject, remember that this contextual listening does include what you're talking about. It may be something very difficult. It may be a difficult conversation. It may be an easy conversation. It may be a conversation that you're calling somebody to say, I heard some news and I'm so sorry. Or it may be, some great news, or whatever the case may be. You may have to deliver some bad news about somebody whose biopsy came back as cancerous, right? So remember what you're talking about during all this, because when you listen for that and you deliver some of that message, how you listen to that, you have to listen to it in that context, that container of what's going on. Another thing is money, and money is always huge. In terms of today's dentistry. This dentistry is expensive, come on, let's face it. And good dentistry is even more expensive. So remember that a lot of people will have finances, okay, on their mind when they're talking to you. Don't just walk around it, okay? If they bring it up, ask them about it. Say, tell me a little bit more about what your concerns are. Tell me what your concerns are. I understand that you're concerned about money, so tell me about that, okay? Money influences decision making for everybody, and that includes me, and that includes you, okay? So why would our patients be any different? All right. Another part of listening is something called reflecting. I think a lot of us do that pretty naturally. That's probably the one listening skill that we do fairly well. So reflecting is the art of showing the person what you are observing in them. So you can reflect that in person or on the phone. Some of the things that you might want to reflect back to the person is their emotional state, joy, fear, anger, excitement. Oh, I'm so happy for you. That is so great. You sound so excited. Wonderful. Gosh, that is awesome. Okay? Now, none of this I'm saying with any... I'm not faking it. I'm being authentic in what I'm saying, okay? So reflecting back to people is important. Also reflecting back may include things like, Mrs. Jones, sounds like you're really nervous about this. Would you like to talk about it? How can I help you? Those sorts of things, okay? Another important point is the intensity of their reaction. Some people will be very non-intense, almost withdrawn, and they are scared out of their minds, for example. I mean, fear happens to be one of those things in dentistry that is probably one of the biggest reasons people don't seek dental care. So that's why I mention it. Emotional intensity can also include their frustration. Maybe they've been to 4 dentists and they've had all horrible experiences and they are sick and tired of what's going on. Listen to that intensity. And obviously, if they're very, very upset, one of the most important things you can do is just to listen to them, okay? Don't try to correct or defend or pretend that you know the answer or anything like that. Just listen. Just listen. The answer will be evident at some point, okay? And again, when they finally feel understood, they're going to be open to hearing what you have to say, okay? People will leave a dentist because they don't listen to them. I get that an awful lot. So I know that if you're hanging into the program to this point, that you're not going to do that. I have confidence, okay? All right. The other thing that is important when you reflect back to people is listening for these inconsistencies in what they say. What do I mean about inconsistencies? If somebody is telling you that that the health of their mouth is really important, okay, but yet their actions are proving otherwise, or what they're telling you they would like to do, that's an inconsistency. So you want to listen for these inconsistencies. You don't want to ignore them, you just want to listen to it. And when they've finished talking and you've given some silence to allow them to continue talking, You might mention them. So, Mrs. Jones, what I heard you say is that it's very important for you to keep your teeth. In fact, you said there almost is nothing more important to you. Yet what I also heard you say was that it's not going to be possible for you to come in to have your teeth cleaned every 3 months. So I'm a little bit puzzled. Can you tell me a little bit more about that? All right? Gentle way of helping people see that there's a little bit of inconsistency there. And so, for example, if you said that, then be quiet. Let them talk, okay? And, you know, they may be telling you that they want to keep their teeth, but it's not really what they want. It's their personal choice, okay? We can't make somebody do something that they don't want to do. If we try to, they're going to leave. So there are going to be these people that are going to make choices that you would not make. Get used to it. Get over it, okay? It's not about you. But your job is to help them be as healthy as they want to be. And you can't do that unless you are listening very closely. And part of that is listening for these inconsistencies. Because if they're happening, there's a problem. All right. You might also want to reflect back a couple of these other things. One is the match or lack of matching between their behaviors and their goals. If you start out by asking somebody, Mrs. Jones, tell me what your goals are for your dental health, they might look at you like you came from another planet, okay? But it's very important to listen to what their goals are. There's a number of goals that people will almost always have. I would condense it down to these three things. They want to look good, they want to avoid pain, and they want to keep their teeth. And there may be some more, but that's what you're always going to hear. And it really is truthful, okay? They may be in a situation where they're not able to achieve that because of what's happened thus far, but you can go a long ways towards helping them achieve that. Another thing that you might want to reflect back is when something doesn't fit with the rest of the conversation. Sometimes people will say things you're like, where did that come from? Oh my gosh, you know. So sometimes it's just important to, I would say almost all the time, it's just important to allow some silence and kind of look at them. And if they don't say anything else, you know, I'm a little puzzled. You mentioned this. Tell me a little bit more about that, because I'm a little lost now, okay? I mean, don't act like you have all the answers, and don't ignore something like that. They had a reason for saying it, most likely, okay? So pay attention to something when it doesn't fit in the conversation and inquire a little bit more about that. Okay? Paraphrasing is something that most of us probably do pretty well. Let's refine that just a little bit more. So paraphrasing is, of course, repeating back to somebody in a way that they really get what you're trying to say. I would encourage you to not use the same exact words that somebody is saying to you, okay? That's common, but that doesn't really get the essence of what we're trying to get when we talk about paraphrasing, okay? We're trying to say it back in a different way which captures the essence of what they're trying to say to you, all right? Because if you're able to do that, they're going to say, yeah, you get it, you get it. And, you know, they may not be like that, but they're going to nod their head, yeah, okay? So, use different words. Look for ways to do that. Don't just be like a recorder and say, okay, so you said blah, 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 blah. Okay? Look for ways to paraphrase that. Remember, I said earlier that people can't always say the things that they want to say. They may not have the language, the vocabulary, the understanding in order to be able to do that. All right? Another thing about paraphrasing is that it helps you focus on the conversation and get them focused about the conversation. So sometimes this is done in very similar language and sometimes in quite different language. being able to do this is really a great thing to be able to do. So you will find that you're able to maybe slightly move or navigate the conversation a little bit different if you're able to paraphrase and get it focused a certain way, okay? Now, truth-saying is a very difficult thing for most people to handle. Most people would rather walk around it than actually tell the truth. But let me tell you something about truth-saying. Most people do not have anyone who will tell the real truth about themselves or how they are affecting those around them. Most people don't have those kind of people in their life. When people in their environment do present them with the truth, good or bad, it often is done in a very hurtful way. You know, that may not be the intention, but most of the time it is the intention and it's very hurtful. So, tread cautiously when you are telling the truth about what's going on. You may have a patient, for example, who comes in who's advanced periodontal disease, and they're in their 50s, and there is not going to be any way. They may say, I want to keep all my teeth and I want to have a perfect smile. You can attempt heroic dentistry if you want. I think one of the things to talk about is to tell the truth about that in a gentle way. Said, you know, Bob, I'll give you an example. It might be, you know, Bob, here's where we are right now, and I have some concerns about helping you achieve what you want to achieve. And so here's what I really see. I mean, if we look over the past 50 years of your life, your actions have gotten you to this point. I'm really concerned that if we, or if you spent all this money, that you're going to have some regret or remorse about having to do that when you continue to lose teeth. Okay? So that's telling somebody the truth. Notice that I did that with a softer tone. I didn't beat them up about it, but I also told them the truth. Okay? That truth saying is super, super critical. Another thing about truth saying is this, is that you can take care to present the truth in a respectful and sensitive way, right? I just showed you that. So some of the truths that people may need to hear, I emphasized may. Some of the truths that people may need to hear are how others are affected by their behavior. I once had this gentleman that came into the office, and he was always very flirtatious with ladies that worked for me, and it was very bothersome to them. And so I had to sit down with him one time and say, I closed the door and we sat, and I said, Bob, I need to talk to you about something that you probably don't realize is going on. Okay, so I'm being sensitive, I'm being respectful, giving him the benefit of the doubt. And I said, when you come in and you are responding to the women who work for me in a certain way, it makes them feel very uncomfortable. And I value you as a client, and you are a wonderful person, you truly are. However, what I'd like for you to do in the future is to give them the same respect you give me. Would you be willing to do that? Okay? So remember that the truth saying is very important about how others are, how they affect others. Another one is how marvelous they really are. How often do people get told that? I mean, when I'm talking to a client, maybe they've come in for home care and they have just come a long ways in their home care. Do you know how much it means to them to say, Mrs. Jones, I just want to tell you, you have come such a long way and you are doing a fabulous job. They are going to smile like you wouldn't believe, okay? And that's so easy. I mean, it took me, 5 seconds? So remember, people love to hear that if it's truthful, okay? If it's truthful. So when you're doing that, you want to make sure that that you're able to say it in a truthful way, but also tell them that. I always recommend, well, I recommend that you always, I recommend that you always look for some way to compliment a person. It may be something as simple as, thank you for making your appointment on time today, or you really look great. I mean, don't lie. I mean, if they look awful, don't lie, okay? But look for some way to compliment people. I mean, you know, people need that. All right, they really do. And you're not doing it for any ulterior reasons. You're just doing it because you care about people and you are demonstrating that. If you don't care about people, we got a problem, don't we? Okay, we got a problem. So, share that, please. Share how marvelous they are in some way and look for a way to compliment people when they come in. They don't want to come in and get bad news all the time. And they're certainly not, they usually don't get it even from their spouse. Okay? Another thing about this is, I briefly mentioned, is how they affect others. You know, people sometimes will come to you and be really hurtful towards you. You know, one of the things I hear a lot is, "Hey doc, I don't mean this personally, but I hate dentists." Okay, they don't really mean it that way. But if people are saying things in a hurtful way, then you might say, "You know, Bob, every time you come in, you say that, and it just, you know, I really care about you, and I care about your well-being, and I'm doing the very best that I can for you. And when you say that, it hurts my feelings. So, do you think you can stop it?" All right, there's nothing wrong with that. All right, there's nothing wrong with that. That people are often embarrassed. Sometimes they don't even want to open their mouth, or they're ashamed because they haven't received dental care, or maybe that the care they had in the past didn't work out. Some people maybe came from small communities where the only thing the dentist did was pull the tooth, because by the time their parents took them to the dentist, all they had left to do was to remove the tooth. So tell them that, hey, it's okay where you are. There's nothing wrong with it. All right, it's just where you are, and I'm here to help you get to where you want to be. Okay, so I'm going to work with you and do everything that I can to help you. All right, so that's a really important point for you in terms of truth saying. I briefly mentioned this, and I want to emphasize again about how their behavior can be in or out of line with their goals. All right, one of the things that I would recommend that you say, and I'm giving you lots of information, so maybe listen to all this again, but ask for permission to say to a person, "So, Mr. Jones, here's what you want to do, and here's what we've decided to do. We've collaborated and developed a plan, okay? Do I have your permission to call to your attention when you're not following through on your part of the plan?" Ask for their permission. Now, I've never had somebody say no, okay? However, by asking their permission, then they're going to say, "Yeah, you told me about that, and thank you for bringing that up," okay? Or they might do something else. But asking that permission is very important. So in terms of the truth saying, that's super critical. The other thing about truth saying is that when other people are trying to sabotage their best efforts, I see this mostly happening in husband and wife situations, for example, where one of the other is wanting to be, have treatment and things like that, and the outside source, the third party, the significant other, whoever it is just stopping them from doing that. So if that's what's happening, you just got to say, "Mrs. Jones, I can't help you in the way that you want to be helped if this continues with your husband putting a stop to it." All right. So you've got to bring that up, because otherwise they're so used to it they're not going to see it, or maybe it will encourage them to have a discussion with their spouse about that. All right. Clarifying distinctions, I think that's pretty obvious. There is a distinction between words and phrases, and it's very important to help people distinguish between what those are. Okay, so you may need to use some words that help them understand that a little bit better. So these subtleties are very important, especially in dentistry, because as you know, dentistry is a very complex topic. Okay, it's very complex. So help them clarify those distinctions. I mentioned about listening for values. That's one of the most important thing. And I mentioned about navigating. So remember, listening for what's important to them is super critical, and paraphrase, reflect back to that, what you hear them say. So Mrs. Jones, it sounds like to me what's important to you is ABC. Okay? So to be truly helpful to people, you must learn to listen past their immediate needs and wants. Okay, I mean, they may come to you, and most will, because they're in pain, they have a tooth bother them or something like that. In all this, you want to listen very, very closely for what their values are. Okay, listen very closely. And if they're doing things, if they're focused on goals that are not in alignment with what their values are, it's just wasteful. And you can bring that up in a nice way. You can bring that up, but listen for their values. Maybe help them see what those values really are. Another thing is if you're not sure what the goal is, ask them, okay? Just ask them, all right? You'll sometimes see people do things where they have a certain goal, but there's a disconnect. Okay, they're missing appointments, they're not showing up, and maybe they just need a simple phone call to say, "Hey, this is Dr. Smith, and I'm a little bit concerned because I haven't seen you, and we spent some time together, and have you changed your mind? Do you want to come sit back down and talk again? How can I help you?" Okay. So that simple thing will call to their attention something that maybe you missed when you were listening, okay? Maybe you missed it. Another thing that I want to go through very quickly now are just some listening realities, and this is kind of a synopsis, so to speak. Remember that people are at different stages of development, and they're going to require different styles of listening, all right? People are at all different stages of development, emotionally, intellectually, etc. So that's a super critical thing. Another reality about listening is that there are hundreds of things to listen for. I mentioned that. Some of those things I've talked about today, and I'd like for you to get as many of those as you can. Build that repertoire, okay? You've got something to work towards now. Another one is that it's easier to listen when you have an appreciation for everything that's going on in a conversation. Right? It's very easy to listen to that. So how do you do that? You got to be quiet, right? Remember my listening pebble, right? You'll become a better listener when there's less going on in your head. Chatter, chatter, chatter. Cut it out, cut it out. Create an environment that you don't have that. Chatter is our worst enemy as listeners. Okay? You are a professional listener. So cut out the chatter, please. Okay? Try it. Do your very best. It's hard, but you can do it. I know you can do it. People will repeat what is important to them and tell you everything you know. In fact, they'll repeat it 2 or 3 times if you're listening. They'll repeat it. It's not rocket science. Listen. And you'll notice that they're going to repeat it. So there's no guesswork involved in this. They'll repeat it, and I find at least 2 or 3 times, if not more. They'll tell you. They won't have to say it. I told you. They'll just repeat it in different ways, but you'll hear that if you're very, very close to listening with your whole sense of being. Number 6 is, as I mentioned, listen for what the patient doesn't understand or what they can't say. Dentistry is complex. And just listen for that. Help them when at all possible. Say, it sounds like this. Is that what you're trying to say? Okay, if they say no, say, okay, well tell me more then. Very simple. Open-ended questions are very important in listening. That goes into questioning, which is something else. Listen to what's motivating the person. Mentioned that earlier, so don't forget that. Another point is that carefully choose what you respond to. Not everything needs a response, right? You don't have to pick up on every little thing and respond to every little thing. You're listening for the broad strokes, and you're helping pull all that together. The other thing is that, remember, is listening is different from asking questions. There are times that it's appropriate to ask questions. Remember my 80-20 rule, okay? You've heard it before, so it's not my rule, but 80-20. Listen 80% of the time and only talk or ask some questions 20% of the time. And most of your talking should be asking a question to help that. There'll be a time that you're going to explain and help them understand it, but initially you're going to listen. And the last thing to do is listen to your own reactions to the person. We all have that sort of thing happen to us, okay? Learn and understand it's important that you don't just, react. I hear it from patients, he was just so mean to me, So this was somebody that wasn't paying attention to their reactions and they didn't control it and respond in a thoughtful way later. So I hope today this time that you have spent has been valuable to you. I encourage you to practice, practice, practice. It's something that I practice every single day, and I will the rest of my life. And it's fun, and I become of more value to everybody that I can become a good listener to. So my best wishes, and thank you for your time.